and we are live.
All right. Hello and a warm welcome to Healing Healthcare Authors Tour with your host, Sharon Weinstein, and myself, Dina Redinger. We are co-authors of the book, Healing Healthcare, this evidence-based strategy to mend our broken system. Nurses remain the backbone of healthcare, and little has been done or even studied to remedy a system in crisis. If this is not addressed now, humankind will suffer. The book is packed with solutions to the problems that plague our healthcare system today, the problems that lead us to troubling sentiments among our prospective nurses. Nurse leaders share their experiences, their thoughts, their evidence, and their strategy to ensure the health of our healthcare. What you'll find within are actionable steps for fixing a system that currently is suffering in silence. We must get this book into the hands of all of those who are making decisions. But before we start, we want to acknowledge you and we want to thank you for joining us. We have viewers from all over the globe, and we want you to use the chat and let us know where you're from, and we will have a replay available on LinkedIn as well. And now I'd like to send this on over to Sharon to introduce our guest today. And I'm very excited about this guest as well. Sharon?
Thank you, Dina. Thanks for that. I really appreciate it as well. We're so thrilled, as Dina said, to see so many of you today. And our guest for today's session is a colleague of mine for over 30 years and an absolutely outstanding professional. As a dean, an influencer, a researcher, a consultant, and a change maker, Dr. Alina Kushkyan has seen and done it all. For over 3 decades, Alina has led the field in healthcare and academic spaces. She has served as director of Yerevan State Armenian American Medical College Erebuni in Yerevan, Armenia, actively contributing to nursing education, academic research, community development, lecturing, and healthcare management. Alina played a critical role in reforming nursing and nursing education in her country, pioneering the creation of the country's first 3-year nursing program and 4-year baccalaureate program in nursing, the BSN, in collaboration with the University of California at Los Angeles, supported by the American International Health Alliance and USAID. She was instrumental in establishing the Armenian Nurses Association in 1995. And something that I hadn't mentioned before, Alina is also the founder of the first chapter of Sigma Theta Tau, the International Honor Society of Nursing in all of Eastern Europe. This is a true accolade. Her chapter in the wisdom section of our book is called 16 Strategic Steps That Drive Wisdom, Securing Our Future. In this chapter, Alina shares the valuable lessons that we have learned and that we can apply to nursing's future. So before I officially welcome Alina, I want all of you to understand Armenia is very far away from the United States. I have been there hundreds of times, and to me, it is also like the motherland. It's an amazing, amazing country of absolutely fantastic people. What we do know is that nurses all over the world, regardless of where they are, have the same challenges. Maybe not the same compensation, but they face the same issues related to recruitment, related to staffing, related to wellness, related to well-being. So we invited Alina to be a part of this book because she brings a unique wisdom to the printed page that our readers must see. Welcome, Alina Kushkyan. We're so glad you're here.
Well, good morning. Thank you. Thank you, Sharon, for introduction. I am so excited to be a part of this program. I'm involved in this project because I enjoyed working with you, with Sharon, many years, and with Dina recently. The opportunity to share wisdom with our readers through Healing Healthcare, it's an honor, and I'm so pleased to share my chapter. I'm happy for that book because I'm like as a physician, and healthcare management worker, I understand the importance of this resource in healthcare. Just for 1 second, when we imagine healthcare without the nurses, we will understand it will be impossible to have a health. Everywhere, nurses has the greatest role and doing every day a big role to care and treat people around the globe. And in every difficult situation, we everywhere see the nurses, how they keep, how they show the solidarity to be together and give everything at help to people. But in the same time, the pandemic is show all of us the problems, what kind we have. And we understand we need to pay much more attention on the work of nurses and how we can to improve the work and life of the nurses.
Okay, well, I'll ask you the next question and then we'll switch back to Dina. So as a physician and a dean, you lead a very famous school of nursing and have advocated for the nursing profession since we first met in Yerevan in 1993. It seems like so long ago. During that time, you remember we started the first school of nursing with the former First Lady, Lucia Petrosian. You remember
Right.
we took that trip to the orphanage, we identified candidates, we started from scratch, really from scratch, from nothing. And from nothing, we created something so, so wonderful that is creating nursing's future and the healthcare future of your country for years to come. What have you learned along that journey that led you to this list of 16 steps? Where did that come from? Why is that important?
The success of our school, and why not my success, is a result of collaboration with my peers from throughout my country and in the world. I realized that the benefit of strategic partnership and that education is perhaps of our greatest values. And education across the borders and countries, it's enrich of each of our countries. It is fantastic opportunity to have this global connection, collaboration, communication. Now, in nowadays we have this opportunity to exchange our knowledges, our experience, and it's a time when we can show how we can to very peaceful working together and support to change or improve healthcare system and improve health of people around the globe. It's a very important and good opportunity for all of us. And during my career, I learned that the 16 principles, they have an important role for organizing good work. That's the different principles. One is the first is competitive salary, which is very important. For example, for my country, the nurses has a low salary. This is important part. Again, this another is a problem around the globe when I see it's a very healthy working condition. Sometimes we see the nurses, then they don't have a good, comfortable equipment or ventilation or anything for normal and comfortable work. then it's for balance. For example, I know many countries where no any places for we talk about nutrition, but many hospitals, they don't have any place for eating or spend time for resting there, or very high level. They working very hard, and they we see around the burnout of the nurses and emotional very they stressed, and we sometimes forgot about that the nurse also is human, and they have the same physiology as a patient, as the doctor and the relative, and they need to rest. And the people, and especially people in healthcare, must be pay very strong attention on this problem, because now I think the health of the nurses is much more important. We need to have healthy, happy, with good energy nurses, and to provide good care for the patients, who can and will be happy to working as a nurses. And different, for example, collaboration for government, the support, or for example, insurance or family living, or mental health support, the professional development. For example, this my lovely place part invest in the team to enhance their skills. It proves the commitment of the growth of your team. Then leadership development. We have inside leaders, and we need to support and train to develop leadership inside of who can to manage good teamwork. And then inclusive and diverse culture, create an inclusive workplace inside of organization, transparent communication, also for the good workplace. It is very important to inform it to nurses about the organization goals, about the changes, about the decisions. This it's transparent communications helps employee feel more engaged, and recognition and feedback around. We see sometime I'm look because very often we are going and see the practice of our students. Sometimes we see the heroically worked and very clever, hardworking nurses, and they are very happy when you say them and recognize, say good words there, and you very talking very friendly. Sometimes we can to hug them, and very they are appreciate for that, because I think it's a blessed profession is a nursing, and also the constructive feedback helps employees grow much more professionally.
Right. You know, Alina, I think we don't want to give away all the secrets. We don't want to tell everyone everything in the 16 principles. Yes. We want to keep them guessing. So I think this is a good time to switch back to Dina. Dina, did you have something else?
Yeah, so Alina, you have so much in this chapter, but Why do you think that people that are in healthcare need to buy this book? Because I'd love to get your thoughts on that. Why is this book so important? They should get it.
In my opinion, people must buy this book and read this book for understanding many, many nuances of the work of organization and retraining and of the work nurses. This book, I think, will be very useful if they will read healthcare managers for organizing much more right work and beginning the reforms in workplaces for well-being of work for the nurses and for nurses. And also, just I would it maybe now is not conducted with this theme. I like to say another words. We look as a nurse, it's a standing the doctor in what and is put what in one hand, right hand is the nurse and the patient. This together make the great changes, and this work but the government support and the report can lead many good changes in work of the nurses, and not only in local but in global. That's why this book is necessary to read for understanding many points.
Thank you, Alina. And I think the point that you have is really that this is a global challenge. This is not related to any one system. This is a global need that everybody has. And so I want to thank you for that answer in your 16 strategies, because I think they're very powerful. Sharon, back to you.
Yes, and unfortunately, all good things must come to a close, and it's time for us to close, and an invitation to join us again next week as we welcome Dr. Vicki Good, another one of your peers, to the program. Please do join us, listen in to Vicki's interview, and see what she has to say about healing healthcare. Alina, thank you for joining us today. We are so thrilled to welcome you. Bless you. We appreciate you so very much. And I look forward to seeing you in the United States in December.
Perfect.
Thank you.
Take care.
Bye, Alina.
Thank you.
Thank you. Bye, everybody.
Bye.